Hello guys, it's Unit 2 Part J. Today's topic, fetal circulation. Before knowing fetal circulation, if you learn the normal human circulation, then you'll understand it very properly. First, starting with placenta. Placenta is attached with the mother, so placenta supplies blood to the baby. From placenta, 100% oxygenated blood goes to the liver and it goes through the umbilical venuses. From umbilical venuses, 100% oxygenated blood goes from placenta to liver. When it reaches liver, in liver, a deoxygenated blood comes from ductus venosus. From ductus venosus, deoxygenated blood comes, and from umbilical venuses, oxygenated blood comes. And here the both blood gets mixed up. And this is the first place where the oxygenated and deoxygenated blood is getting mixed up. Here the blood is actually 100% oxygenated. This 100% oxygenated gets mixed up with the deoxygenated blood and becomes 80% oxygenated blood. From the liver, the blood goes to heart through inferior venal cava. From inferior venal cava, now 80% oxygenated blood reached right atrium. And here deoxygenated blood comes from superior venal cava. From inferior venal cava we get oxygenated blood, and from superior venal cava we get deoxygenated blood. And this is the second place where the oxygenated and deoxygenated blood is mixing up. And here you need to observe here. From right atrium and left atrium, there is a way, there is a opening, and this opening is not seen in normal human beings. This is seen only in a baby which is in womb. And this opening is known as foramen ovale. This is the hole between right atrium and the left atrium. The blood which is collected here from inferior venal cava and superior venal cava which is collected here, this blood actually divided and goes in two ways. Partial blood goes this way, that is from right atrium to left atrium through foramen ovale, and partial blood goes from right atrium to right ventricle. Partial blood goes this way and partial blood goes this way. After blood comes here, almost all the circulations is like the normal human beings. From right ventricle, the blood goes to left atrium. From left atrium, what happens? The blood goes inside the lungs. And in fetus, that which is inside the womb, the lungs is not functioning. So, the blood just goes in and comes out. The blood is not purified here. The blood just goes in and comes out. That's it. The blood goes and comes back to the left atrium. From left atrium, the blood goes to the left ventricle. And from left ventricle, the blood goes to aorta. And now the blood which came here is 60% oxygenated. And there is another connection which is in between seen. This connection is known as ductus atherosus. This connection is seen in between the left pulmonary artery and aorta. There is a connection between aorta and the left pulmonary artery. In between there is an opening, so blood which comes here partially get mixed here. If you are not understanding, just see the blood which comes from left atrium to lungs, that blood, there is an opening here. So this blood gets mixed up here and it goes in circulation. This 60% oxygenated blood is circulated in the whole body. After circulating in the whole body through descending aorta, the blood goes back to the placenta through umbilical arteries. When the blood goes back to the placenta, the blood will be 40 to 20% oxygenated. We started from 100% and we are ending with 40 to 20% oxygenated blood. And one more thing, in this in this circulation, 100% oxygenated blood is not circulating in the fetus body. Only 60% oxygenated blood is circulating in the whole body. Clear? Now we are going to see the changes that occurs after the birth. The very first change that is seen here is this connection gets disconnected. Immediately after the birth, the umbilical cord is cutted or disconnected. In umbilical cord, the three connections are present. Two umbilical arteries and one umbilical venous. This three connection is disconnected and this three connection gets disclosed. And the next one is ductus venosus. and this connection is present in the liver, and this gets disclosed immediately after the birth, but completely this gets disclosed around 2 months. And next is ductus atrocis, and this is present in between pulmonary artery and aorta, and this connection gets disclosed immediately after the birth, but it completely gets disclosed around 3 weeks. And the main thing is this one. This is foramen ovale, and this is the connection. It is in between right atrium and left atrium. This gets disclosed immediately after the birth. If it is not getting disclosed, then it is complications. These are the changes that occurs immediately after the birth in fetal circulation. I will provide questions after completing this whole chapter. That's it for today, guys. Let's meet in the next video. Until then, stay tuned.